We all face challenges in life. Sometimes these challenges can feel overwhelming. When these feelings persist and interfere with our daily lives, it might be a sign of a mental disorder. Mental disorders are medical conditions that affect our thinking, feeling, and behaving. They are more common than you might think. Millions of people around the world experience mental disorders. These disorders can range from mild to severe. It's important to remember that mental disorders are not a sign of weakness. They don't discriminate. Anyone can be affected regardless of age, background, or lifestyle. Mental disorders are real medical conditions, just like heart disease or diabetes. They require professional help and treatment. Ignoring the signs and symptoms can have serious consequences for individuals and their loved ones. Seeking help is a sign of strength, not weakness. It's the first step towards recovery and a fulfilling life. Depression is more than just feeling sad or blue. It's a persistent feeling of sadness and loss of interest that affects daily life. Imagine a heavy weight on your shoulders dragging you down. This is how depression can feel. It saps your energy, motivation, and joy. Symptoms of depression can be different for everyone. Some people may experience feelings of worthlessness, hopelessness, or guilt. Others may have changes in appetite, sleep patterns, or energy levels. It's important to remember that depression is not a one-size-fits-all disorder. It can manifest in different ways. If you're feeling persistently down, it's crucial to reach out for help. Talking to a trusted friend, family member, or mental health professional is a good first step. Remember, you don't have to go through this alone. There is hope, and help is available. We all experience anxiety from time to time. It's a normal human emotion that helps us cope with stress. But when anxiety becomes excessive, persistent, and interferes with daily life, it can be a sign of an anxiety disorder. Imagine a constant feeling of worry or fear that never seems to go away. Anxiety disorders can manifest in different ways. Some people may experience panic attacks, which are sudden episodes of intense fear. Others may have social anxiety, making it difficult to interact in social situations. Physical symptoms such as a racing heart, sweating, or difficulty breathing are also common. Living with anxiety can be challenging, but there are effective treatments available. Therapy, medication, and lifestyle changes can help individuals manage their anxiety and live fulfilling lives. Remember, you don't have to suffer in silence. Seeking help is a sign of courage and strength. Bipolar disorder, previously known as manic depression, is characterized by extreme shifts in mood, energy, and activity levels. Imagine a roller coaster with its dramatic highs and lows. That's the nature of bipolar disorder. These shifts can last for days, weeks, or even months. During manic episodes, individuals may experience feelings of euphoria, increased energy, racing thoughts, and impulsive behavior. Conversely, depressive episodes are marked by feelings of sadness, hopelessness, loss of interest, and low energy. These extreme shifts can be disruptive to work, relationships, and overall well-being. Bipolar disorder requires professional help and treatment. Medications such as mood stabilizers can help regulate mood swings. Therapy can provide individuals with coping mechanisms and support. With proper treatment and support, individuals with bipolar disorder can lead fulfilling and productive lives. Section 5. Schizophrenia, a disconnection from reality. Schizophrenia is a complex mental disorder that affects a person's ability to think, feel, and behave clearly. It's characterized by a disconnection from reality, often referred to as psychosis. Imagine having thoughts, feelings, and experiences that are not based in reality. Symptoms of schizophrenia can vary from person to person. Hallucinations, such as hearing voices or seeing things that aren't there, are common. Delusions, which are false beliefs that are not based on reality, are also prevalent. These symptoms can be distressing and make it difficult to distinguish between what's real and what's not. Schizophrenia requires long-term treatment and management. Medications, such as antipsychotics, can help control symptoms. Therapy can provide individuals with support and coping strategies. Early detection and treatment are crucial for improving outcomes and quality of life. Section 6. ADHD, a different pace of life. Attention deficit/hyperactivity disorder, or ADHD, is a neurodevelopmental disorder that affects attention, impulsivity, and hyperactivity. Imagine having a brain that's constantly in overdrive, making it challenging to focus, sit still, or control impulses. Children with ADHD may have difficulty paying attention in school, following instructions, or completing tasks. Adults with ADHD may struggle with time management, organization, and impulsivity. It's important to note that ADHD is not just a childhood disorder. It can persist into adulthood, affecting various aspects of life. ADHD is manageable with proper treatment and support. Behavioral therapy can teach coping mechanisms and strategies. Medication can help improve attention and reduce hyperactivity. With the right interventions, individuals with ADHD can thrive and reach their full potential. Section 7. Causes. The complex web. The causes of mental disorders are complex and multifaceted. It's rarely a single factor but rather a combination of genetic, biological, environmental, and psychological influences. Imagine a puzzle with multiple pieces that contribute to the overall picture. Genetic predisposition can increase an individual's susceptibility to developing a mental disorder. Brain chemistry and imbalances in neurotransmitters also play a significant role. Environmental factors such as trauma, abuse, or neglect can have a profound impact on mental health. Psychological factors such as stress, coping mechanisms, and personality traits also contribute to the development of mental disorders. It's important to remember that mental health is not a simple equation. It's a complex interplay of various factors that influence our well-being. Section 8. Treatments. Finding your path. Just like physical health conditions, mental disorders require professional help and treatment. The good news is that there are effective treatments available to help individuals manage their symptoms and live fulfilling lives. Finding the right treatment plan is like finding the right key for a lock. It requires careful consideration and collaboration with a mental health professional. Therapy, also known as psychotherapy or counseling, is a common and effective treatment for mental disorders. It involves talking to a trained mental health professional about your thoughts, feelings, and behaviors. Therapy can provide you with coping mechanisms, strategies to manage symptoms, and support. Medications such as antidepressants, anti-anxiety medications, and mood stabilizers can also be helpful in managing symptoms. These medications work by correcting chemical imbalances in the brain. It's important to note that medications should always be taken under the guidance and supervision of a qualified medical professional. Section 9. Real-life examples, breaking the stigma. Mental disorders are more common than you might think. Many successful and well-known individuals have openly shared their struggles with mental health, helping to break the stigma and encourage others to seek help. For example, actress and advocate Demi Lovato has been vocal about her battles with bipolar disorder and addiction. Olympic swimmer Michael Phelps has spoken candidly about his struggles with depression and anxiety. Their stories remind us that mental disorders do not discriminate. They can affect anyone, regardless of their background or accomplishments. By sharing their journeys, these individuals help to normalize conversations about mental health. Real-life examples like these show us that recovery is possible and that seeking help is a sign of strength. By breaking down the stigma, we can create a more supportive and understanding environment for individuals with mental health conditions. Section 10. Mental health awareness, a shared responsibility. Mental health awareness is not just the responsibility of individuals with mental health conditions, it's a shared responsibility that requires a collective effort from individuals, communities, and society as a whole. Just like physical health, mental health is essential for overall well-being. We need to create a culture where it's okay to talk about mental health openly and without shame. We need to educate ourselves and others about mental disorders, their symptoms, and available treatments. By increasing awareness, we can break down stigma and encourage help-seeking behavior. We can all play a role in promoting mental health awareness. Start by educating yourself about mental health. Talk openly about mental health with your friends, family, and colleagues. Support organizations that advocate for mental health. Together, we can create a more supportive and understanding world for individuals with mental health conditions. Section 11. Seeking help, a sign of strength. If you're experiencing persistent symptoms of a mental disorder, it's crucial to seek professional help. Reaching out for help is not a sign of weakness, but a sign of strength and self-care. Just like you wouldn't hesitate to see a doctor for a physical health concern, you shouldn't hesitate to seek help for a mental health concern. There are many resources available to help you find the support you need. Your primary care physician can refer you to a mental health professional. Mental health organizations, such as the National Alliance on Mental Illness, can provide information, support, and referrals. Remember, you are not alone. There is hope, and help is available. Taking that first step towards seeking help can be life-changing. It's a journey of courage, resilience, and recovery.